He said News Talk 760. Good evening, everyone. I'm Anne-Marie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to talk about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR.
We're on Facebook.
Oh, we are?
Yeah,
Facebook
right.
Live
We haven't been on
is back
Facebook
again.
for a long time.
That's
It's been
true.
weeks.
I know. Well, we had some technical camera problems. Was that it? Yes. Film problems.
Now we're back, and
Now we're back.
we have to work for the full hour.
That's right. No breaks.
Right. So we're going to talk vaccines today because I've got patients calling me asking me which vaccine booster should they get for Omicron.
Mm-hmm.
And so I spent a little time doing some research on, what's going on with these different vaccines, and apparently a lot. So we'll have a show about it, and keep in mind that we're on channels and social media that, doesn't let us talk freely. So we're going to have to talk in code.
Right. Well, read
as
between
best
the lines.
we can. Right. Well, so yeah, we're not going to be full bore with our opinion as much as we can, but we'll be as obvious as we can be.
Well, the question I have is, are any of these boosters or vaccines for the Omicron, are they mandatory for whatever reason, for jobs, for school entry, now that of course, everybody's back to school now, so it doesn't matter.
I don't think they're mandatory for, for adults, but they're being recommended.
Mm-hmm.
And, again, I think the big issue here is children.
Mm-hmm.
What are we giving our kids? Why are we giving it to them?
So since this is not a really serious part of the disease process, I don't even know why they're vaccinating, because look at Ashley here, who's had it 3 times, and she's had all kinds of boosters. Anyway. Pharmacy. Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm Anne-Marie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome again to your live broadcast. What's the update now on what were we saying, vaccines?
Well, I thought we should talk about vaccines today because I had one of my patients come in who wanted to ask questions about what vaccine she should get, whether it's, which one, because of the new boosters and Omicron and all that. And, interestingly, she prefaced the whole conversation with, I hate the FDA. I don't like taking pharmaceutical products, all that. And then into, I'm fully boosted. Which one should I get next? Which I thought was like a contradictory.
Yeah, what is fully
stance.
boosted, and why should there be a next?
Well, if you're if you're skeptical of the FDA, why are you getting a vaccine anyway? Because it's the same concerns that you have about the FDA and distrust apply to the vaccine as well. More so, I think, because all of the issues to me are amplified by COVID, not just status quo, but they're all been amplified. So after I had to talk to her, I thought, okay, we have to have a show about the new strain of vaccines coming out, because this is what I'm being asked now is, which vaccine should I get? So I thought we should start by talking about natural immunity, which is really important because, previously we were saying that prior exposure to various strains of COVID did not give immunity to the Omicron, especially BA4, BA5 versions. And even immunity in prior exposure to BA4 and BA5 didn't give you immunity that you can get COVID again. But now that more data is coming out, it's turning out that that's not true, that prior exposure to COVID of any kind gives you immunity to the current Omicron. So there is natural immunity with Omicron BA4, BA5, which is important to know. And since it's so active, it's so contagious, it's so, it's endemic in the society. Most of us have been probably exposed to Omicron, whether you've been symptomatic or not, and have some degree of immunity. So that begs the question, do we need a vaccine against something 95% of us may have been exposed to? And there's no question that 95% of us have been exposed to COVID, period, in one form or the other. And that establishes a strong degree of natural immunity. And of course, that's never brought up in recommendations by anybody. There's no conversation about natural immunity. So we'll start our vaccine conversation today with, we probably are all immune, and we know that we have some degree of immunity to the current strains that are out there.
I mean, it's just amazing. I mean, I feel as though you're absolutely right about the fact that so many people are wandering around and we don't know if we've been exposed to it, if we got it and ignored it. I've talked to so many people that have had a bad day or felt as though they had the flu, and who knows what they had because they didn't go and get tested. And I've also known a lot of people who did get tested and were surprised to find out that they tested positive.
Well, I look at it just as being endemic to the population now. It's just out here. It's a virus, and we all get it. And nobody wants to be sick for 3-4 days, and it might be a little more severe than the flu. But even though there are COVID deaths reported, still don't know if that means it's death from COVID or death with COVID. I do know that hospitals are now beginning to not screen everybody who walks in the door. That's happening, which is good. That should drop, COVID death data points, because if they're not screening everybody who walks in, but I imagine if you're critically ill, they're going to screen you for COVID no matter what. So those are good things, that the disease strain is less virulent, but it is more contagious, and that we all have some degree of natural immunity. Those are all good things. Then the question comes up again is, all right, there's multiple versions of vaccines coming out.
How's a person to know?
Well, that's what we're going to talk about today, because you don't know. So Pfizer and Moderna each have a version of the vaccine, and these are bivalent vaccines, meaning they have part of the original vaccine plus a part that provides some immunity against BA4 and BA5. They each have one. And Moderna also, and they also have one that just says BA1. So that's what's happening in England. In England, they're giving this, the bivalent with BA1, which makes no sense at all because there's no more BA1. It's gone. So the NHS, in all its wisdom, is going to vaccinate the English population with versions of a vaccine to a virus that no longer exists. So that's what the English people have to look forward to. And in America, we've got bivalent Omicron, Pfizer and Moderna, and then Novavax. So next segment, we'll talk a lot more about what those vaccines have in them, what they are, and of course, we're always open to phone calls.
And who should get them. Okay, right now we've got to take a short break. You are listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you ought to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. And why does I hear the microphones going, sort of in and out like.
Oh, should we take the call when we get back?
Yeah, that's what I'm going to do. I
Okay,
just
sure.
didn't want to start with them because we got
Right.
down to like a minute. And I have to remember to say, God save the king.
Right. Well, you can do that.
Well, that's appropriate to do.
Okay, good.
That's at the end. Oh my God.
Oh,
I
at the
can't
end of
believe.
the show?
Yeah. No, I can't believe it because he became king today automatically.
Charles.
Yeah. I didn't even think that would happen.
I thought he was going to give it to William.
Well, that's what everybody thought.
But no, he's waited his whole life for this moment.
Well, he didn't have a choice. I mean, that's not how it works. He's
Right.
told what he has to do because he's
Right.
an employee of the realm. So it's kind of like whatever the queen decides, whatever the reigning monarch decides, and she can forgive him that position if she wants to, but she probably didn't want. See, this whole thing, like, I know the British government so well. They probably knew days ago exactly when she was going to die. Well, we're on Facebook, so we
Yeah.
should be talking about something else other than God save the king. But yeah, I mean, I don't know about this vaccine thing. I think that it's kind of amazing that there's. I mean, look at Ashley here. Ashley had how many different boosters that you had? It didn't do you any good. You got COVID anyway, 3
Yeah,
times.
I had like both the vaccines and then one booster.
Didn't work.
No.
Well, there's a lot of data that shows that people who are vaccinated get COVID more often. And
Wow.
and so in highly vaccinated countries had higher COVID rates than unvaccinated countries. So exactly what that means, we're not going to say because of the new YouTube rules, but that's what's been shown in data is, you're hearing about how, look at Israel. The whole country's been vaccinated and boosted and 4 shots, and they've had the highest infection rates in the world during these times. So getting vaccinated doesn't necessarily keep you from getting the illness, but the idea is that you get vaccinated to not have serious illness and hospitalizations. But unfortunately, we still don't know if we're getting hospitalized and put in ICU because of COVID or with COVID. And we just don't have that information to tell us.
Okay. Well, the question is, I mean, since it's not a very serious strain, is it worth it? Is it necessary? Is it worth
Well,
it?
you can ask that question. And I got to credit this guy.
Well, credit him as soon as we
Yeah.
come back. And then we'll take a call. Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we are now able to arrest and reverse the progress of these silent killers. We're inviting listeners to call in with your questions at 800-859-0957. Welcome back, listeners. And before we get into more information about the vaccines and COVID, Ashley, you have a caller?
Yes, we have Greg calling from Shelby. Greg, what's your question?
Hey, good evening, beautiful people, Mr. Positive. Got to ask you twofold, Dr. Kolender and the All-Star crew. Number one, with confidence, do you think that these vaccines won't cause cancer? Number one. Number two, what is the difference between an mRNA shot and the vaccine? Hopefully it's a great segue for tonight's show.
Well, thanks. Unfortunately, with the new YouTube rules, we're not going to comment on, I want to say, adverse events that are not documented from the vaccine because we do want to stay online. But I truthfully don't think that there's enough information to say that. But again, we've not been given the information because the FDA decides to bury the data on results of the vaccine for 75 years. So even though they've been court ordered to release the data, they really aren't releasing the data as court ordered. So we just don't have the information to answer that question. And I'm going to move the show along just because I've got a agenda a little bit. So I'm going to defer your last question. Maybe I'll answer it in what we're talking about. So before I move too far along, I do want to credit Dr. John Campbell, who has a YouTube show that I watch and get a lot of my vaccine information from. So a lot of what I'm talking about is coming from his research and what he puts on the air, which unfortunately is also blunted because of the YouTube COVID misinformation rules that have been put in place. And we'll say that in quotations. So Pfizer and Moderna put out their bivalent vaccines, meaning it's some of the original vaccine plus a Omicron BA4, BA5 variant in there. And it's already been approved for emergency use authorization. The government, meaning President Biden, has already bought 170 million doses. So here's a new vaccine. We don't know much about it. There's not much about it online that you can learn. And it turns out that the research for the emergency use authorization was based on animal studies alone. So literally, the vaccine was given to 8 mice. And within these mice, they showed an increase in antibody response from the vaccine. And that was enough for the FDA to approve this drug to humans on an emergency use authorization.
Mm-hmm.
There's no human studies on it. The human studies will start after these vaccines go into the population.
So many questions out there, but I have to refer back to you as a specialist, as a doctor, as an internal medicine board certified doctor. You have a big practice. Are your patients coming in? I mean, we really need to rely on, we can't rely on the FDA to impart the information. It's hot off the line. We have to rely on our doctor. How else are we going to find out whether we should get it? And my question to you is, should older people be getting this new vaccine? Should ones with pre-existing conditions be getting it? And should they not all be going back to their doctor, their PCP, to find out if they should get this vaccine?
I want to be fair that there are some things that I do in my office. When I mean things, I'm going to say treatments that I offer that don't have much more than animal studies behind them. But I tell my patient that, we're going to do a procedure here. It's an injection. It's experimental. The process of making this product is oversighted by the FDA, but there's no studies in humans to support using this, but I still use it and I'm happy with the results that I get, so I continue. Can I tell anybody in my practice with confidence to go get a vaccine that has no human data, that's been approved by the FDA based on 8 mice, not 9 mice, not 7 mice, but 8 mice? And that's the basis for the FDA, our governing body that's there to protect us from misinformation, from snake oil salesmen, from unsafe drug manufacturers. And this is what we're getting from that organization from which the whole world makes a lot of their decisions. So the government has, in their wisdom, bought 170 million doses of these vaccines for us based on the antibody response to mice. I guess it's one for every Democrat.
Oh, that was well said. But anyway, let's not go down that road right now. Let's, I do want to come back and ask you who should get the vaccine and whether or not we're really overreacting from the beginning when we started out on the COVID journey and people were really afraid of going to the hospital, being intubated and not surviving. But people are surviving this variant.
How do you recommend a vaccine that has no human studies? And it's not well publicized. I mean, it's in the internet if you look, and I'm following somebody who, provides this information, but even he says, look, I can't find this. I know this is true, and here it is. It's actually on the FDA website.
Mhm.
I should be clear. He quotes it off the FDA website. Who knows? It might be gone tomorrow.
Right.
But that's a choice that they made. So, how do you recommend a vaccine that has never been studied in a human? I can't. And like you said, in my clinical experience, um, the current strains of COVID do not cause a severe illness that
Right.
that requires hospitalization. We've been able to treat everybody at home. No, I do not prescribe Paxlovid because it's the same concept. This was a drug that's put out with, in my opinion, minimal testing, not enough safety studies, and it's well known that Paxlovid causes rebound COVID.
Mm.
So if I'm going to tell you, Anne Marie, you're my patient, and I'm going to prescribe you this drug for this virus that you have, the virus is probably going to go away on its own in 1 to 3 or 4 days. And even if it doesn't, I can support you. But I'm going to give you a drug that might make it go away faster. It might give you a really foul taste in your mouth that takes a while to go away. And it might cause you to get COVID again.
Then it's not worth the risk, obviously.
Well, who's going to take that drug if you explain it that way? I mean, even the president had rebound COVID, and it's just, well, this is what happens.
Mhm.
Well, why does this drug exist when it causes the condition that it's made to prevent or treat? There's no common sense here at all. So it's really hard for me to recommend anything going on right now, especially when the current strains are just not that serious. And where's the emergency to have an emergency use authorization?
Right, exactly. And obviously, this particular strain is certainly not as dangerous as the original strain that was out there, but still, people feel very unsure.
Well, unless we're really worried about mice and we need this vaccine to protect the mice.
Well, in any event, I come back to the same thing that I've said all along is that people really need to rely on their doctor's advice. In your case, you're very responsible and you are, obviously shepherding all of your patients through the process. But for the common listener, for the people out there, they just don't know. They're kind of lost. There's a new vaccine out. Should I be getting it? Should I not be getting it? There's just a lot of confusion, and they're just basically, as I've said all along, most of them are absolutely lost. And we do have other callers, but we'll take them when we come back on the other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you ought to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. So I'm coming back to segment 4, yes? And are you still
Yes.
continuing on with vaccines?
Well, we'll take callers now.
Yeah, well, there's one,
Let's see
there's
where that
Dave,
goes.
and we'll see where
Oh,
that goes, and
okay.
then, I don't know, we'll see who else calls.
Oh,
But you know what? I wanted to say, but I thought there's not enough time to get into it. Is this just really all about pharma finding another way to make more money?
Well, let me read the YouTube COVID misinformation platform before I answer any questions that you're asking.
Did they make like more like rules for it and stuff?
Yeah.
Oh my god.
So there's a whole thing what you can or can't say. So you really can't say that a vaccine is ineffective. So we're not saying that a vaccine is ineffective. I'd like to think we're okay by saying, how do I prescribe a vaccine that has no human studies? I mean, how do I tell my patient that it's safe when I don't know that it's safe because it's not been tested on humans?
Well, I mean, everybody that's getting any kind of vaccine for anything, whether that's the MMR and whether it's the polio vaccine or whatever, you're all taking a chance. And
Well,
why?
that's not entirely true because other vaccines have had years of study behind them and years of time to look at side effects. 7 to 10 years is usual the study time for a
Right.
vaccine, not 7 months or 8 months or 10 months. So other vaccines are pretty well established, and I recognize that there's a lot of controversy, and a big portion of the population thinks vaccines trigger immune responses that are inappropriate. But let's say, okay, I don't want to say no, but let's just say there's a lot of data on other vaccines that we don't have for these new vaccines. So, informed consent is important. And the fact that the FDA is not releasing information about the original studies tells you, what do you think? Something's being hidden. 75 years is enough time for the people that were involved to die and not be sued or go to jail for what they've done.
Mm-hmm.
And that's why they've tried to bury it for that length of time. And still, media is starting to wake up a little bit. A little.
But I mean, again, it's like, okay, they rushed to come out with this new vaccine for a disease that's so watered down at this point that my question is, does anybody really take it seriously that they, I mean, we all know that half the people have probably had this strain of COVID and didn't know they had it, and they've got natural immunity. And I'm just wondering, I mean, I understand the original, Pfizer and Moderna, vaccines way back in the day when the hospitals were bulging at the seams and everybody was going on a ventilator and the amount of death from it was really high. But now we're dealing with a watered down version.
Depends who you're talking to. If you're talking to me, so you're hearing my interpretation of it. If you're not, here's my patient who came in the other day and saying, I don't believe in the FDA and I won't take any, pharmaceutical products, but I'm fully boosted.
Mm-hmm.
Well, if you're learning from media that's pushing the vaccine, well, then that's what you know.
Mm-hmm. All right, Ashley, we're going to you. So
Okay.
who's the second call?
Paul.
We'll take Dave first of all, right?
Okay.
Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. He's here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. I'm coming back to you, Ashley, because you have callers.
Yes, we have David calling from Windsor. David, what's your question?
Yes, good evening, guests. I wanted to ask a couple things that are related to the vaccines. First of all, shouldn't your doctor have a look at you and check you out to see if you have and if you are in need of a vaccine? The next thing that comes to mind in regards to that is that many times we hear about these vaccines and so many people getting sick after they've received so many of them and dying. And what about therapeutics in regards to that, regardless of the A5 or VA5 or whatever you want to call it and everything else in regards to all that in terms of therapeutics? Because you've got to, when it comes to Omicron or whatever you want to call that, shouldn't your nose and your nasal passages be allowed to drain out all that excess fluid that it has before it creates even further problems?
All right, David, let's let the doctor answer. Go ahead, Dr.
Well,
Collender.
thanks for calling, David. These days, the question of whether you do or don't get vaccinated should definitely be left up to the doctor and patient. There should be a conversation that's done in a, HIPAA-enforced room where there's freedom to make a medical decision for yourself. And I think that applies to a lot of things, and we'll not go into that. But that should be a doctor-patient decision, and in my opinion, should not be mandated, which it's been. So I don't think these new vaccines have been mandated, but maybe they're going to be. I don't know. As far as, prevention, protecting your nasal passages, this is why we recommend using, like an iodine solution You can use colloidal silver nasal sprays to help kill the virus, and do a spray daily as a preventive method. It's not 100%, but diluted providone iodine, and that may help. I'm not against masks either. Should we mandate masks? No, it's a personal decision. If you want to wear a mask to keep yourself from getting COVID, I mean, I wear masks in the office more than ever, which is new for me. Now, I don't wear it every day or every patient, but if someone comes in who's sick, all right, now I put a mask on. That's my
But I
adaptation to
thought
COVID.
the mask was to prevent you from giving it.
Well, not to me. Well, I shouldn't be saying this on the air because I think the state still mandates that all medical offices wear masks every time.
see.
So, yeah, we wear a mask all the time in our office.
All right, well, let's come back to Ashley and more callers. Go ahead, Ashley.
Yes, we have Paul calling from Commerce. Paul, what's your question?
In your ads that lady does for you, she says that it's in your profile. I haven't the slightest idea what she's talking about. What is my profile?
Well,
All right,
thanks
Dr.
for
Collins, explain what profile is. Good question.
I will. Thanks, Paul. So when we're referring to the profile, that is a collection of imaging and inflammatory blood markers that gauge our risk of having cardiovascular events. So, we're taking off our COVID hat and putting on our prevention hat. That's what the profile means, is disease identification, measuring the status of your inflammatory, what's happening with your arteries in terms of inflammatory injury, and finding all of the drivers of disease that affect artery health. And so that's my day job, is making sure that we're preventing heart attacks and strokes among patients in my practice. And we call it Know Your Profile. And that means measuring your artery wall thickness, the layers of your artery wall, with a test called a CIMT, carotid intimal media thickness test, and blood work that measures artery health, and looking for other diseases that cause chronic illness like sleep apnea, insulin resistance, oral health, genetics, gut health. All these different things impact our long-term, how we live and how we are optimally living our lives over the long haul.
And risk for getting cardiac disease, obviously, because once again, as I always mention on every show, 700,000 people dropped dead last year, according to the CDC, of heart attack. And we now have we have the tools, we have the tests, we have the technology in this country to prevent it. And that's basically what Dr. Kolender is explaining to you about what your profile is. That it's incumbent upon all the listeners, the patients out there, the everyday man and woman, to, really stop and say, am I being screened enough? Am I being tested enough? Am I getting the right types of tests? You go to see your doctor every year and they draw blood and they may take an EKG and do whatever other tests and exams they do. But you're not getting to see your profile, really. You're not really getting to look at, where do I stand? What is my risk factor? And this, I think, differentiates the type of prevention practice that Dr. Collender has. And also with concierge medicine, he has more time to stay with the patient and to indulge in these very highly technical tests, which I believe that we're all entitled to. And I think that everybody who's listening should get the CIMT, regardless of whether insurance is paying for it or not. They're inexpensive tests, but they are life-saving tests. And after that speech, Dr. Collender, do we have any more to say about prevention or to fill in on screening?
Well, we always have something to say about prevention. I mean, that's what we do all the
Right.
time. And so, it's, even though the listeners hearing that may say, well, my doctor's doing these things, unfortunately, they're not. And the standard lab panel that you get, most of you get the same thing, is your gateway to quote unquote prevention, which falls short, because 750,000 deaths a year from heart attack. There's 1.5 million deaths per year between heart attack and stroke, or at least events total.
Right.
These are not numbers that are going down.
No, they're
You know,
going up
they're-
every year. They're in
right.
fact going up every year.
There's a huge increase globally on cardiovascular death. And, when I think of all of these diseases being preventable, all these events are preventable, it's just a huge shame. And, what's behind it is these are tests, meaning what all of you get, not what I do, but what all of you get are tests designed to have you prescribe drugs
Mm-hmm.
or tests designed to lead you to the operating room. And none of this, and that's looked at as prevention. And even this method of prevention is failing because we're still having so many deaths, and which eventually lead to chronic illness for the survivors.
Well, one of the other things that I think people need to pay attention to is you go into your doctor and they send a phlebotomist in and say, we're going to do a blood draw. But what does that blood draw mean? It's a severely inadequate blood draw. And what you're talking about when you're talking about screening and you're talking about labs, you're talking about a highly complicated examination of your blood. And talk a little bit about differentiating that.
Well, the approach to prevention is completely different. It's not what's happening today. I'm sick today. Your arm hurts. Let's fix it. You got a cold. Prevention is a long-term look. It's looking ahead 10, 15, 20 years, finding conditions that aren't an issue today, but will be in 20 years.
Right.
And we can find those and address them today so they're not an issue for you ever. And that's prevention. And so unfortunately, we just don't have that mindset in this country. We've got to find people that do.
Yes, and every patient has to be their own advocate and make sure that they are getting the proper screening and the proper testing. Okay, right now we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and what you have to do to prevent disease. When we come back, if you have a specific question on the subjects we're discussing this evening and you'd like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR. Segment 5, right?
Yep, it's the last one.
At the end, okay. Yeah, see, when you hear these people, I think the big thing is like when you're doing a blood test, when you go in to see the doctor, well, let's take your blood. They're assuming that it's some kind of magical thing that the doctor is going to be able to look at and see everything. They don't understand that there's a crucial difference between what you're doing and the type of testing and screening you're doing and the type of Mickey Mouse blood test that they're getting in the doctor's office.
Well, people don't also think they have no idea what's being tested for.
Right.
And to them, they're being tested for everything, whatever everything means.
Mm-hmm.
So that means if you get your labs and the doctor says they're okay, that means everything's okay because in your mind, everything was checked. I don't even know what that means as a doctor. What is
Right.
everything? There's 1 million blood tests.
Right.
And you only get the blood tests that are ordered. And of course, we already know that insurance doesn't cover prevention. So there are no preventive tests being done.
Right.
And they may promote prevention through their advertising and marketing campaigns,
Mm-hmm.
but they're not really doing prevention
Mm-hmm.
because they're failing at preventing deaths and chronic illness. All these things are getting worse and worse.
Mm-hmm.
So the country's been brainwashed to accept the status quo,
Mm-hmm.
and it's hard to break through. You're talking about 60, 70 years of this kind of messaging. It doesn't end overnight.
Mm-hmm. Yeah, and I think the other thing is just the reliance on like the primary care doctor. We sort of feel that, well, if he notices anything that's out of the ordinary, then he's going to bump us up, to the next specialist up the flagpole.
Well,
Cardiologist, endocrinologist.
they don't have any better tools for prevention than your PCP does. And,
I
and you know
understand.
that. But people don't, because when the cardiologist tells you you're okay, well, that's an extra layer of false reassurance.
Okay. Well, I don't know. I don't know what the answer is. I mean, It all comes back to each patient has to be their own advocate. Each patient, each listener, everybody that's listening to the show, they've got to write down and know what the CIMT is and, what type of blood test they're getting, what type of screening they're getting, what is the importance of their cholesterol. I mean, it's like they almost have to be, some kind of medical specialist themselves to know even what to ask for.
Well, we've gone through what people should look for, multiple times on
Yeah.
the shows to help be your advocate and make better decisions for yourself, because you're just not going to get this kind of information, even to glean what's available from the standard panel. And oftentimes for people that are a little higher risk, it's there.
Mhm.
It just, did your doctor recognize it and take a couple seconds to let you know about it? And if it's not imparted this information the right way, you may or may not take it seriously.
Mhm.
So again, it takes time. All of this education takes time because it's new and it's not part of the normal vernacular. And
Mhm.
so all my patients need constant re-education.
Mhm. You have what? One call?
Yeah.
All right. Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat the chronic and debilitating diseases. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. I'm going to come back to you, Ashley. You have a caller?
Yes, we have Norm calling from Milford. Norm, what's your question?
Yeah, good evening. Can you hear me okay?
Yes, we're hearing you. Go ahead.
Okay, great. Yes, thank you. First-time caller. I caught part of the program last Thursday, and you talked about that CMIT test and being more proactive. I'm not familiar with that term, and I heard it described just a few moments ago, but my first question is this. I did get a test. I called it a calcium score probably 3 years ago. And I wonder if that's similar to CIMT or if that's something altogether different. So I wanted to get the doctor's remarks on that. And then a
Sure.
follow-up question. Yeah, just a quick follow-up question. I'll ask both, and then I'll stand by and listen. My primary care physician recently retired, and I'm more interested in what you're talking about in your program, getting more proactive and thinking long-term. So I wondered if you had any recommendations for, someone looking for a primary care like myself, because I have to pick a new one. So, yeah, if you could answer those two questions, I would appreciate it. Thank you.
Well, I have a question for you. What was your calcium score result?
So I believe it was 69.
Okay. And
at
what
the
did your
time they
doctor do
said-
about that?
Mostly talked about, eating differently. They did also want to do statins. I wasn't real comfortable with that at the time. So I've tried more, I'll call it nutritional eating, being a better eater. Not sure how successful I've been, but I'm continuing to go down that path. All the arteries were clear except one, and the one that got the score of the 69, of course, was the Widowmaker. But I've gone in for like EKGs, I think once since then. There's been blood tests. Nothing profound, nothing that would make me think, we've got real good eyes on this and understand it completely. So when I heard you talking, it sounded very interesting to me.
Well, a calcium score is a good test to get if you can't get a CIMT, because the beginning of prevention is disease identification. And a calcium score is a great way to identify disease. And so now that you have plaque, you have coronary artery disease, whether you want to hear that or not, because they found
Yep, no, I
plaque in
understand
your
that. Yeah.
coronary arteries. So, in addition to optimizing lifestyle, which is what you're trying to do, starting a statin is the right decision, and you should do that because statins reduce artery inflammation. So you know that you have plaque. You have no idea if you're inflamed or not, if you're making it more or not. So until you know more about what you're doing, a statin is like a great backup to making sure that your arteries are quiet while you go on this journey of figuring out why do you have plaque, what's causing it, and what conditions you have, other conditions you have that you don't know about that may contribute to plaque. As far as a referral, we're not really promoting other doctors on the show, of course. So Anne Marie will throw my number out if you want. You can start there, and we have myself and a few other doctors in our office.
Right, and that is 866 Kolender. If you want to call Dr. Kolender directly, it's 866 KOLENDER. I mean, it's interesting how so many patients out there, they get to step one, which is taking the CT cardiac calcium scoring test. They get a score, and then what happens after that?
Well, his doctor tried to prescribe a statin, but again, when you have only a few minutes to talk about the results, you can't explain it in a way that's conducive to compliance.
Mhm.
Well, I don't want a drug. What can I do without a medicine? And even though I agree that I don't want to take a pill either, I take a statin
Mhm.
because I have plaque.
Mhm.
And so, that's, I'm trying to optimize my lifestyle. And then I'm taking a statin for backup. And hopefully one day I'll be able to stop it and my lifestyle will hold down the fort. But until that happens, I'm doing all the things that I tell my patients to do.
Well, even with a score of 69, which is not terribly bad. I mean, positive score is not good, obviously, but we've had callers that have called in the hundreds, and we had one caller call in at
2,500.
2,500. Horrifying. But I mean, so just so that we understand and the listeners understand, is that if they do have a positive score, albeit an under 100 score, should they all be then put on statins?
In my opinion, yes.
Hmm.
So a lot of doctors will have a threshold and maybe they'll say over 100, I'll prescribe a statin. Well, prevention is acting on the information you have right then and there. And most doctors still are, they're thinking about risk of having an event. And somebody with a lower numbers, has a lower risk of, dying from a heart attack in 10 years. Well, what about beyond that?
Hmm.
And so you still just don't have enough information. I'm pretty aggressive with anybody who has any degree of plaque because that's my job.
Right.
I'm telling you, I'm going to stop you from having a heart attack or stroke. The sooner you come in and the cleaner your arteries are, well, that's where you're starting.
Hmm.
We're going to get better from there. So it's not about how much can I get away with and how am I going to stop it before a serious outcome occurs like
Mhm.
death or heart attack or stroke that leaves you disabled. We're aggressive on day one or wherever you are. And wherever you are when you walk in and get identified and measured and have your markers taken, you can get better from there. So if you're alive, then you can improve. And I even have 80-year-olds walking in for the first time. Well, some people go, I'm 80. What does that mean? Well, it means you're alive.
Right.
And we can make you better than you tomorrow than you are today.
Right.
Just you've got to learn what you've got to do and do it.
And so coming back to our last caller, Norm, who asked the question about the CIMT, which he had heard about but did not yet get, to a patient like him, would you recommend having, since he has a positive score in the calcium score, to get the CIMT? And what difference would that make?
Well, absolutely. And the reason is a calcium score is not good at monitoring progress. So he would not go. Now, his doctor might order another CIMT in a year and say, hey, let's see what's happened. That's the wrong thing to do.
Or another
Because,
CT scan or
sorry,
another
another CT scan,
uh-huh.
sorry. But a CIMT, the CIMT ultrasound, gives you the data points that you can measure year to year to follow your progress. So changes in your CT calcium score don't quantify with risk changes. To me, it's a one-time thing. You have plaque or you don't. To start the process of prevention. If your calcium score is 0 and your CIMT is normal, all right, then we repeat it all in a few years.
Right, we follow up.
But we still look for the drivers of artery disease because I have patients who have all kinds of problems and they have no plaque.
Right.
We still want to prevent dementia and Parkinson's and Alzheimer's and cancer.
Right, exactly. So it's all very important. But again, incumbent on the listener and the patient to make sure that they get these tests, to make note of CIMT and the other testing and screening that you do in the practice of prevention. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, Anne-Marie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 p.m. for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well, and God save the King.
Opinions heard in the preceding program are those of the host and guests and not those of Cumulus
That was
Media
a
or
good show.
WJR Radio.
I thought it was really
I'm
good.
surprised we didn't get more callers because it was a hot topic.
Yeah, but sometimes